Gaurav, good to see you. Welcome to the program today.
Thanks for having me.
It's great to see you. And if you could just start off with a little bit about your background and what you're doing with MyPhysicianPlan.
My background, I'm computer science engineer by background, and I was actually on Wall Street for a good 10 years before pivoting to healthcare about 10 years ago, or more than 10 years now, almost. Uh, but when I'm pivoted to healthcare, in Wall Street, we used to constantly say that healthcare is probably the only industry which is more regulated than Wall Street is. And that is probably true. But once I pivoted over, I also realized that we do have a lot of red tape. And unfortunately, that is what is preventing access in a lot of cases. And it seems to affect most the uninsured people because you end up being treated like this pariah, which doesn't have care. And no matter which doctor you go to, you don't get good access. You get charged a humongous amount, which is nowhere near what reality is. The same thing happens with prescriptions, and the same thing happens with lab tests or anything else that you do, like which you need. And coming from India back, I mean, to me, primary care was like something which is really affordable. And to me, being in America, finding that there are like 15% people who don't have good access to a doctor, and just because they don't have insurance, it's not just that if they get cancer treatment, it's difficult to get, but like getting their routine chronic care visits can get like a big amount which you can't cover otherwise. So my co-founder Ramdev and I, we started looking at this problem, and Ramdev actually told me that if we break that piece apart and look at primary care component only, we can clearly build the infrastructure and the technology to make this happen at a much more affordable price. So his initial numbers were like, we can cut like more than 30-40% of the red tape, which happens at the primary care level. And that brings down the price substantially enough that it makes it very affordable for anyone to get access, as well as make it possible for these people to get taken care of their routine visits, so be it sick visits, chronic care visits, your prescriptions. And when initially my gut feeling was that, no, that would be too complicated to build. But the more I looked into it from a compliance point of view, from a healthcare point of view, it was like, no, it can be done. And at that point, it was more like, why are we not doing it when we can make this thing so much affordable, especially for primary care?
Yeah, no, I love this. And we're seeing it so much around the world too. And again, MyPhysicianPlan, if I remember correctly, it's both available in the US and around the world. So how are you doing? I mean, everyone who's on this program is pretty well familiarized with healthcare systems, health management organizations, both staff and group models, PPOs, EPOs, and just everything that's going on with network solutions and different ways of channeling patients to providers. What are you guys doing to build this global network of physicians to give patients affordable access to these networks?
So our approach has been. I mean, first of all, we're not globally yet. We are only in the United States. But the main approach that we're really doing is especially when you look at the primary care part of it, it is primary care to me, or the way our experience has been is fairly simple. Yes, they still have to deal with these 120 or maybe 200 plus CPT codes, but at the end of the day, it is coming down to like this interaction between the physician and this thing is coming down to all these 20, 50, 100 codes are coming down to just a simple visit, whether it is an in-person visit, it's a televisit, is it a long visit because it's an annual physical, or it's a first-time visit. So we looked at the whole scheme on how doctors are getting paid, and we simplified it significantly. It has become so simple that in most cases, like not most cases, in all cases, it is even before the doctor has seen the patient, based on just the basic information that the doctor asks for you when you're trying to get an appointment. Just based on that information, it is clear exactly what kind of visit to expect and what is a reasonable payout for the doctor for that visit, for example. So we take that into our consideration, and we from our point of view, we even before the moment the patient checks in with the doctor can get paid. Typically gets paid within the same day. In fact, within hours, the doctor has the payment done. So the doctor is secure in terms of what they're being paid. There's no red tape to worry about. No haggling afterwards with the insurance company or anyone else on what your CPT code was. Was it the right CPT code for this visit or not? You just need to have a different CPT code and you'll still get paid the same amount. There's no haggling. And you're guaranteed this upfront payment, right? So you know and by doing this, we also get out of the way of what the doctor and the patient want to do, right? So we are saying that if the patient needs to go to the doctor and the doctor is happy to take that visit, then we'll make sure that payment happens, and it's as simple as that. So that has significantly cut out red tape tremendously, which is helping us bring a lot of savings to the system, which potentially we can now share with the doctors, right? So we are paying doctors a fair amount. It may not be as high as what some of the other insurance companies are paying, but it is reasonable for the service that they're giving, and they're happy to do that.
Yeah, especially with these kinds of remote platforms. Talk a little bit about that. I mean, again, you guys are enabling this age of digital care to bring healthcare services and healthcare expertise to patients that would otherwise not understand it, not be able to access it, whether they're visitors coming in from another country or they're students in between jobs or they're people in between jobs or whatever it might be. So how is digital helping you build your platform?
So from our point of view, though, so from a digital health point of view, we have simplified the entire process end to end, right? So the patients are able to get to, or members are able to get to the website any point in time, sign up at any point in time, and technically, like because of that process that we have streamlined so much, even at the onboarding side, the card and the member immediately gets a digital card, which is active the same day, and he can use to visit the doctor the same day. So that process is extremely streamlined and straightforward right now, especially at our primary care net doctors, which are part of our network. They can visit the doctor. The doctor can also go online and verify the same minute that the patient is actually, yes, he has a card and this is a valid, and they can, while they're checking in the patient at the front desk, they can check into the platform as well, which is what most of the doctors do, and they get paid within minutes of making that happen. So this entire process has been streamlined. The patient is signing up. So we have multiple plans. So the basic plan that we have is the primary care plan, which is $75 a month, but it is discounted if you're buying for the full year upfront or things like that. But then we also layer on top of it. We noticed a lot of people signing up with us were visitors coming internationally, because these travel insurances from most countries, when you buy them for the US, they will cover catastrophic needs, but they don't cover chronic needs. So if you are here for multiple months, 3-4 months, even longer sometimes, there's no way for you to go visit a doctor for chronic visits and get your updated medications. So we're noticing a lot of those people were signing up with our plans. So we actually partnered with Crum and Foster, and then launched a US-based travel insurance plan, and in that actually we also use United Healthcare as a backup network for specialists and emergency rooms. But the routine care visits get taken care of. And the same way we layered it with a health share network called for offering people for those unexpected and large medical needs. And later this year, we will be also launching, we're noticing a lot of people signing up are also actually students, because they are very price sensitive and they end up with these high deductible plans, which are really great for catastrophic needs, but then they don't, unfortunately, most of them also don't cover primary care. So if you are a student with chronic conditions, or even your simple annual physical can easily be a couple of thousands of dollars. So we are noticing a gap there, and we'll be launching our student plans probably in the next 2 months to be ready for the next calendar year for the school. And we're also working with the TPA to launch self-funded employer plans, where we can potentially have a custom ACA compliant plan for small businesses that they can offer it to their employees at a substantially, be able to choose the benefits you want and layer it essentially with a primary care offering, that you have something for catastrophic needs, but your primary care is not left on the wayside.
I love this. I love this. What are you doing with AI? How is AI playing a role into this? And again, for the audience from around the world who has questions around this, it sounds like this might be an opportunity for partnership as well for a global implementation, or even a US distribution channel. Just ask questions away in the chat room. But talk about AI, Gaurav, because obviously that's all we're going to be talking about at the summit coming up, whether it's in women's health or whether it's in remote health or whether it's with devices, et cetera. How are you going to be using AI to bring this to more patients and being able to do it more affordably?
So what we are working with AI specifically is we are basically taking a standard model of AI and making a custom version which is specialized to our needs, right? So we are doing things slightly differently. yes, we rely still on a lot of the infrastructure which the existing healthcare network has. So we do want to rely on that knowledge base. But then we are able to layer on top of it our knowledge base, which is what we have. And essentially we're creating this, working on this chatbot, or you don't call it a chatbot, but basically kind of a help assist, which will help people navigate their care, right? So it's not just that they need to answer a generic question, but they need to be able to answer specialized questions the way we look at it, right? Like the way we onboard patients is simple. And frankly, like when I first tried to put my knowledge base into the AI tool and tell it how do I sign up for my physician plan, it gave me like 10 questions that you need to ask this person just before they're on board. But we don't use any of that. So I need to train AI to make sure that it only says that, oh, we only need your name and date of birth and an email address to contact you. That's about it. So all those customizations, we're making our knowledge base on top of AI so that it boosts it with the existing programs, existing knowledge base of healthcare, but be able to be a complete assist so that the patient can come to one spot and get all the answers, all the questions answered.
That's amazing. And there's obviously a lot of opportunities too, just in other models. Like for instance, Amy's going to be talking to one of our companies and that we've been testing, Recovery Plus. They're phenomenal. They're getting nothing but A+ on our scores for not only experiential, but clinical, as well as integrational. They're easy to install and get up and running. How could someone like what you're doing with MyPhysicianPlan work with a home-based recovery platform? I mean, there just seems to be opportunities for you guys to bring in so many different tools from AI to backend infrastructure, even working with groups like Medcuria that we just talked to link in with hospitals' backend infrastructure as their front end distribution or front end provider, like a massive network funnel, from a PPO standpoint. But what kind of distribution channels or what kind of partnerships do you really want to focus on over your next year of growth?
So for the next year, we are focused quite a bit. So I think on the technology side, we have a good sense of where we are. We are focusing heavily on distribution channels, so brokers, agents, payroll companies, universities for student plans. So one is the distribution channel because we want to partner with them and educate them with the offering that we have, because this would help a lot. But while we're doing that, we're also exploring other innovative ideas in digital health that we can potentially incorporate with our platform. So there are a few conversations we are having with, and potentially we'll explore them later this year. And as our user base is also expanding at a good pace, we are at that scale that potentially we can bring some significant benefits if we start using these things.
It's great. And of course, we have an extremely active audience, as you know, right? And they're all doing a lot of interesting things in healthcare. Everyone from, again, like I mentioned earlier, from startups to healthcare executives across payer, provider, employer, pharma. Folks from the NIH, FDA, HHS, CMS are on the show right now. And so one of the questions coming in is just a quick quick answer on this one. How many current patients or lives or whatever you measure your customers, how many folks are using the platform today?
We're still a startup, right? So it's not a big number, and I would say it's in the hundreds, not the thousands yet. But we are at that cusp that I think will very soon be in the thousands by the end of this year.
And does a patient pay on a fee for service, or is it basically all you can eat? Once you pay your monthly membership fee, you can talk to as many folks as you want, or how has that worked?
So once a member signs up, we let them have as many visits as they want with the doctor, especially the primary care, and we like to have a preferred like a home doctor, as you want to call it, because that is where your medical records get maintained. And if you're going for emergency visits or something else, they act as consolidating all that information, and that is one more benefit that we bring in. We kind of actually push our patients a lot that you do need to have that primary care visit and have that relationship with the doctor so that your medical records get maintained. So while we don't act as a repository of maintaining EHR, but we insist that all our patients end up with their medical records being maintained at some place, so that if they have any emergencies, they get covered there. But basically, once you have the monthly fee or one of the plans that you have with us, you have this premium primary care, where you essentially are assigned a dedicated doctor who is your caretaker in a sense to help you in all your health needs.
Okay, that's great. And then last quick question, and we'll jump. But the patient clinical history, that's always important, right? Is that available to the clinician at the point of care, or is that something that the physician is getting when they're talking to the patient in real time?
So right now, it is available to the physician when they talk with the patient directly. But that is also something which we are exploring. That in a lot of these new patients who are just getting onto the system, one of the issues that we do have is that because nothing is maintained in the past, it takes much longer than typical patients to onboard them. So we are exploring some actually AI tools to kind of make that more precise and potentially offer them to the physicians in advance so that they know what to expect from the patient coming in.
That's fantastic. Yeah, I really, really appreciate that. And again, wishing you all the luck in your overall journey really of adoption and diffusion in the healthcare system. And for the audience listening, don't worry, you'll get updates. We always like to bring folks like Gaurav back so they can provide more details on their never-ending journey and insights on what startups should be doing, whether it's getting the next round of funding, or whether it's how to actually get into the provider market, the payer market, the pharma market, the employer market, whatever it might be. And so again, really looking forward to hearing from you. Looking forward to seeing you in 2 weeks at the summit. And for those in the audience, don't forget
Yes,
to sign up for the summit
absolutely.
in 2 weeks. All right. Thank you, Gaurav.
Thank you.